So we're going to turn now to newer work that is really exciting as we turn to do more in the food space. And this is another piece. I get caught because actually every project at the foundation becomes one of my favorites as we're doing such interesting work. But to talk about the work that we're doing in the food and nutrition space, I'm going to call on another of our board members, and that is Sally Greenberg. And Sally, thank you for joining us. We're going to come to your porch and then bring in the virtual porch of Robin McKinnon, who is the Senior Advisor for Nutrition Policy at FDA's Center for Food Safety and Applied Nutrition. Robin and Sally, I'm going to turn it to you to talk about this exciting work that we are doing in the food and nutrition space.
Well, thank you so much, Susan, and thank you for your leadership. And I want to thank Leanne with the Reagan-Udall Foundation as well for her incredible work on food issues and really launching this project for us. And I want to thank everybody for joining us for what's really an important public meeting of the Reagan-Udall Foundation. I have the honor of being able to chat with one of the leading experts on food and nutrition at the FDA, Dr. Robin McKinnon. She and I are going to be talking this morning about one of the Reagan-Udall Foundation's newest work streams, and that is food and nutrition. So just over a year ago, the FDA Foundation convened a focus group of consumer and industry stakeholders along with CFSAN leadership. CFSAN stands for the Center for Food Safety and Applied Nutrition. The leadership at CFSAN got together and talked to stakeholders from both the consumer and industry community to identify how we can best contribute to the sector. Two key areas emerged from that focus group activity, and many conversations followed. The first is the need to explore a public-private partnership related to food insecurity and nutrition-related chronic disease. The second is the opportunity to amplify education about using the new nutrition facts label. Our work in this area feels especially critical in the wake of the COVID-19 pandemic, as many more people found themselves this past year food insecure, many who were not food insecure a year ago or ever. And as more people have been cooking at home and paying more attention to their food choices. So I am going to start by asking you, Robin, let's start at the beginning. Nutrition is, of course, a critical component of individual and public health. So tell me about some of FDA's priorities in this space.
Great. Thanks, Sally. First, I want to say thanks so much to you and the Reagan-Udall Foundation for the opportunity to join today. But as you noted, nutrition is critical, and improving nutrition offers one of the greatest opportunities to improve public health. And we're committed at the FDA to finding new ways to do that. So just to provide some context, we know that chronic diseases like heart disease and cancer are the leading cause of death and disability in the US. And the poor nutrition plays a key role in patterns of chronic and preventable disease. We also know that nutrition-related chronic diseases are experienced at disproportionately high rates by lower income and certain racial ethnic subgroups. So this work is especially important in advancing health equity. But also with COVID, the need for improved nutrition is more apparent than ever, given the increased risk for severe symptoms and death from COVID-19, as you see with those with obesity or cardiovascular disease or type 2 diabetes. So FDA regulates the safety and labeling of about 75% of the food supply. We have key regulatory tools available to us, like regulations, guidance documents that we can apply to a robust science base that help support improved nutrition for all. And these tools work in two key ways. One, in providing information to consumers, often through labeling, and also increasing consumer understanding. But then secondly, working directly with food manufacturers to help improve the healthfulness of the food supply. and encourage healthier defaults. So even if consumers are not aware of some of the changes, or their dietary choices can improve overall. So just as one example, after we required trans fat to be declared on the nutrition facts label in 2006, we saw an 80% reduction in trans fat in the food supply. And then in 2015, issued a final determination revoking the GRAS, a generally recognized as safe status for artificial trans fats, effectively removing these artificial trans fats from the food supply. And so overall, that probably has been averting tens of thousands of cases of cardiovascular disease. So we announced our nutrition and innovation strategy a couple of years ago, which are really our key priorities in nutrition. One, to empower consumers, and two, to foster innovation in industry to offer healthier options that we know consumers are looking for to help reduce the burden of nutrition-related chronic disease. And this nutrition innovation strategy includes implementing the updated nutrition facts label, implementing menu labeling, modernizing standards of identity, modernizing claims, and reducing sodium. So those are some of our key priorities.
That sounds really good. How does working with the foundation support some of these priorities, and what value does the Reagan-Udall Foundation give to the FDA's work in terms of enhancing and the messaging and the day-to-day work that your department does?
Sure. Well, I see it really critical in helping to advance the work of the agency and advancing regulatory science overall. So enhancing our mission to protect and promote public health. And particularly in this area, as we're working together in this area, acting as a convening body and a conduit to stakeholders and the public, and really acting overall to support and extend our work.
Tell me about some of the specific activities that the foundation has done with the FDA, and if you would sort of look forward a bit, how do you see the relationship between CIFSAN and the foundation evolving in the coming years?
Sure. So we've started our efforts first on consumer education related to the updated nutrition facts label. So I kind of concentrate there, but let me step back just for a bit to provide some context. So the updated nutrition facts label is the first major change in over 20 years. The final rule went into effect in 2016, but the compliance date has only just passed. So most of the food packages now in the marketplace should be carrying the new label. And so this was based on updated nutrition science, kept the iconic look and feel of the nutrition facts label, but with some really critical changes. So calories and serving size now in bold font, daily values have been updated, and updated nutrients like vitamin D, potassium, added sugars. And we know, so this is a tool on the back of pretty much every food package. We know about 87% of the consumers check the nutrition facts label. So this is a really important opportunity, a teachable moment, if you like. And so in early discussions with the foundation, it seemed like there was a great opportunity with consumer education. All of this new information is out there. We want people to make the best use of that. And we've heard from focus group testing, as soon as people hear the label is new, they want to know more. Nobody wants to be the last to know. And also when folks hear the same thing from multiple sources, that's also important. So we had developed some wonderful education materials and resources for consumers and health educators, but we really needed assistance in helping to get that word out through multiple channels. And the foundation has been really helpful and critical in helping us do that. So just one example, the foundation has developed a nutrition communicators network, which so there's a social media messaging toolkit that goes out every couple of months, notes any health observances, like May is National Stroke Awareness Month, or other general observances like holidays, and provides suggestions for social media posts, which all promotes the FDA's consumer education materials. It's free to join. And there's a variety of members from public health, consumer groups, industry groups, manufacturers, retailers, and more. Seems to be growing and expanding each month. So we see great value from that. And then finally, to your last question, looking forward, I see this. We've learned so much as we've been working on this nutrition education, and I really see great potential for complementary activities in the future. Really building and expanding on these experiences that we've had in promoting the nutrition facts label education. So I'm looking forward to that in the nutrition space and potentially also food safety as well.
Well, again, thank you so much, Robin, for all the work that you do to make the nutrition facts label a household word in every household in America. We really, I work on consumer issues in my day job, and it's so important that consumers have access to this really good, critical information to keep their families healthy. So, and we're very excited that the Reagan-Udall Foundation is working on this new work stream. In fact, stay tuned for some exciting news in the coming weeks. And I want to remind people that if you want to join the Nutrition Communications Network, email the FDA Foundation, and that will take you to Reagan-Udall.org. So Robin, thank you so much for joining us today. And thank you so much for all the great work CIFSAN is doing.
Thanks, Helen.
Sally and Robin, thank you so much for introducing us and immersing us in the food and nutrition work. Really informative and helpful, and appreciate the great work that each of you does, and looking forward to continued activities. So thanks for letting us join your porch